Well, we are back once again with 5 questions with an ISHLT member, and I am once again Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation, and I am joined today by Kim Anderson. Good morning, Kim.
Good morning.
Well, before we dive into our 5 questions, I can see that you're at the hospital and in your PPE, which is great, but do you mind sharing who you are, where you are, and what your role is in ISHLT?
Yes, so I'm Kim Anderson. I'm a cardiologist specialized in heart transplantation. I'm an assistant professor at the QE2 Halifax Infirmary in Halifax, Nova Scotia, Canada.
Would you tell me a little bit about why you got involved in ISHLT and what keeps you connected to the society?
I think this is an excellent way to keep updated with the recent knowledge and the development in the field of heart and lung transplantation. That's a very good way also to network with other physicians and allied health practitioners who are involved with similar problems that we have related to this very specific population. I think the meetings and the Congress are also extremely interesting. I remember that from the beginning that I was interested in cardiology, I was also interested already in heart failure and transplantation. And since the beginning, every time I go to the ISHLT meeting, I can't choose between all the presentations. They're all so interesting and in topics that are also, I can't choose. So I think I gained a lot from the scientific knowledge, from the networking, and it brings being in this community brings really a desire to go further and find new solutions for the problem we all have. And I think it is very an energizing community.
Yeah, when you get all of these people together to ask the same question, you come up with some really wonderful responses. And I think not being able to decide between sessions is a great problem for our program planning committee to deal with. So I'm glad to hear that too. What inspired your career path? You mentioned that when you started in cardiology, you got interested in heart failure and transplantation. What's your journey look like?
I think what interested me is the long-term relationship that we have with the patients, and the very varied problems and solutions that we can have with patients with heart failure and the treatment, especially the advanced heart failure treatment. For, of course, the situation we face with patients who are on destination therapy LVAD or who had a heart transplantation 20 years ago, the situations we face, the human relationship, the problems that it can have are very different than the usual bread and butter cardiology, if I can say. So I think this is scientifically very interesting, but in a human way as well. And we get to work with a team that is multidisciplinary, very involved, all directed toward the same goal of really helping the patients and building a long-term relationship with them that is beneficial for them. So that's very a rich human work environment. So those are, I think, factors that makes me interested in this specific type of work. Otherwise, I was interested in cardiology for a long time when I was a medical student and then a resident. And the transplantation field was also very interesting to me. I was curious about it and understanding how it works. So I think cardiology, transplantation, both came together.
Yeah, absolutely. And it's wonderful to hear about the human relationships and the compassion that you feel in this field. I think it's something that brings a lot of people across heart and lung and MCS, that everyone feels those relationships are so important. What's a meaningful milestone either in your career or in your field of practice that's on your mind or that you'd like to share?
In my career, well, a meaningful milestone is, I think, that I did a master in clinical epidemiology and healthcare research, and I finished, I think, in fact, I did a good part of it while I was starting my first staff work here in Halifax. And when I defended and presented this thesis, I was very, very proud, relieved. That was a big milestone. And when the main publication from this thesis was published, I was also very, very happy. It received a good press from the public, so I was very happy. I think that's one of my biggest milestones. But I'll always remember the first heart transplantations that I was the staff for it, the first donor call that I took and accepted a patient, that I was the staff doing it. This date is on my calendar.
Yeah, it's an important anniversary, right? When you think about the future of your specialty, what do you see on your horizon for heart transplantation? What do you think is coming next?
I think one of the fields is dealing with a highly sensitized patient. I think that's a field that we are facing more and more. And there's different ways to deal with it, either the way that we prioritize those patients on the transplant list. Should we have an approach that is very safe, of trying to find better donor for those patients? Or should we have an approach that is more aiming at modifying the immune system of the patients, trying to cross antibodies? That's, I think, a field that is very in evolution for a few years, but certainly will continue. The other field that we are seeing more and more is the congenital adult heart transplant patient. So those who survive very extensive surgery, and it's a miracle of medicine to have patients who used to die when they were young little kids. Now they're adult, but they present with very specific problems and challenge, and making the decision on when is it time to think about transplantation, when is it too early, when is it too late, so we can find the right time for the right patients. I hope we will advance in this field, because that's a question that I find sometimes difficult to answer. So I hope this field will develop in the future.
Yeah, and another great example of the multidisciplinary team just being so important, having all the different players working together on every case.
Yes.
So switching gears a little bit, what is your idea of a perfect weekend? What do you do when you're not working on heart failure and transplant patients?
Well, we really like the outdoors. So we are, in fact, I'm starting vacation tonight, and we are going to Kejimkujik Natural Reserve for 2 days of kayak camping. So that's one example of the things we do.
Yeah, get out of the hospital and get outside. That sounds great.
Yes.
Well, is there anything else you want to share with the IshLT community that I didn't ask you about yet?
No, other than thank you for having such a great society, and I'm very proud to be part of it.
Well, we're really happy to have you as part of it, and thank you so much for taking some time to chat with me today, and I can't wait to see what you get up to next.
Thank you.
Sure.
Thank you for your time.